Today is going to be a real interesting and hopefully accessible dive into what are some of the most basic components, I think, of this conference. Looking at living drugs, looking at the idea of cell-based therapies to treat a variety of different ailments. And we got to a few panels today that I think you're going to find really interesting, because we're not only going to explain what this is, how it works, but also introduce you to some of the patients directly who have benefited from this, and you can hear their experiences for yourself. And let me just say thank you again to as we set this up, the reminders about why we're doing this, why we have to balance the scientific progress with this respect for dignity in how we treat these patients, what they're informed of at the time that they are getting these treatments is going to be a big part of the discussion as well. So for this first panel, we really have it's a special panel. You're going to recognize our first guest, all of you will. He is one of the greatest living legends in golf, the Golden Bear. Please welcome Jack Nicklaus. That's right. Pretty good spot there. Please also welcome Doctors Eckhard Alt, Dr. Jason Hurd, and Dr. Mark Allen Lundeen. Doctors, welcome. Thank you. Good morning. I think the way that we're going to do this, again, is to spend a few minutes starting with Dr. Alt, and hear a little bit of the background, and then we're going to talk to all of them, including Mr. Nicklaus, about exactly what he went through. So, Dr. Alt, let me throw it to you.
So I got allowed to speak a little bit also on behalf of my two colleagues, and my talk focuses on the translation from basic research to the application in man. And one patient is sitting next to me. He will report about his experience from firsthand. Now, we talk about stem cells, but we need to be aware not everything is invented, many things are reinvented. And if you look at the first slide, Friedenstein, a Russian scientist, 50 years ago already found cells in the bone marrow that were able not only to replace the marrow, but to differentiate into other organs, into bone and liver. So the magic of stem cells, which have a universal purpose, is not that new. We just forgot it for many years and reinvented it now. What did we reinvent? We found stem cells all over the body. There are many publications that show in every organ have stem cells been described, in the hair, in the tooth, in the skin, and everywhere. The question for me was, when I started stem cell research 12 years ago, is that a single cell for each organ, or is there a universal cell? And it is a universal cell. Nature wouldn't do it differently. It's one single stem cell in your body which has the purpose to differentiate in every organ. And the question was, where are those cells located? Well, would nature place them? And they are inside the blood vessels. They are tiny cells. They are sleeping as a reserve army for the rest of your life. They are silenced by integrin and waiting to be woken up and migrate and differentiate. So the principle is that when you harvest from an organ and you process this with collagenase and a protease, you not only get stem cells, you get a certain degree of stem cells, which depends on the sophistication of your method and the enzyme you use. What you get is a mixture. And that picture shows you electron microscopy just after harvesting. And what you see, you have a mixture of lymphocytes, which are the naked cells on the bottom. And then you have some small cells, like on the right upper corner or next to that lymphocyte, which are tiny cells. They have like 5-6 micron because they are sleeping. They don't need much of energy. And then you have larger cells, which are progenitor cells. And the big confusion at the moment is a little bit that progenitor cells are understood also as stem cells, but they are already made a decision what to become in life. So the early stem cells, always say, is like a train in a station, goes out, and then it splits in endo, ecto, mesoderm, right, middle, or left. Anyway, we found the cells all over the body, and you can differentiate in a dish the cells to become fat cells, to become bone, to become liver, and to become nerves, independent from which organ you take them. So the stem cells from your abdominal fat equally differentiate to liver or to heart as the cells from your brain. That makes it universal, and now I'm going to start with a practical showing my own shoulder. 2 years ago, I made a mistake and went to the Oktoberfest with my bicycle. Shouldn't do it. I got there safe, but on the way home, I somehow fell on my shoulder. And the first picture, October 2016, is a very nice memory because it shows the ruptured partial tear in my supraspinatus tendon. Unfortunately, I cannot have a cursor, but if I describe it, what you see is my shoulder bone, and there is a strip, a black strip above it, and it's interrupted by that whitish edema. Anyway, I got some stem cells injected from my own adipose tissue, which we took out, processed, and within an hour injected it just with a needle under ultrasound control to that point. And you see in January 2017, already there's a little marker which shows that the tendon increased to a size of 2.7 millimeter, exactly at that size where it was ruptured before. And in preparation for the meeting here in March 2018, I got another MRI, and it shows that the tendon still is there. Now, many people might ask, okay, that's radiology, that's MRI, is that a real tendon? So I agreed that we took some biopsies of that after 3 months. And what you see on the left picture is, on the bottom, you see that striation and the collagen 1 staining, which is typical for tendon tissue. In the middle, you see some scar tissue, all that points, which are nuclei. And above that, you see also some brownish on the right side of the left picture, which is new tendon which forms. And on the right side is a special staining which shows that we form a lot of new blood vessels. It's laminin. It's a basal membrane of blood vessels. Now, the question is this collagen 1 expression also tendon? So we do the polarization microscopy. And what you see are two pictures. On the bottom of each one, you have the old tendon, which is more coarse. You see the striation and the structure is a little bit more coarse. And on top, on the right, you see a fine structure, which are new fibrils formed from new collagen that came from those cells. The next picture also shows again, part on the right corresponds to the old tendon, then you have part of the capsule, and there is a large new building of new tendon tissue, which is really expressing not only the collagen 1, but also other factors for tendon and the striation. My son had a skiing accident, so I tell you the whole family story. He was formerly a ski racer, but for 10 years he didn't do something, but went with his old buddies, which even were now at the Olympics, downhill in Kitzbühel, but that was too fast for him. So he ruptured his middle. The middle picture shows his ACL, anterior crucial ligament. And as he knows that we are doing stem cells, he got just an injection of stem cells in his knee, no operation. And on the right side, you see already after 3 weeks or 7 weeks, the tendon became firm. He's doing everything today, playing football, skiing, and so. So no operation. That's the patient on the left. It's hard to tell you. There's a little fine line where the arrow is, which is a tear in a meniscus. He also got just stem cells injected in his knee. And on the right side, he just recently from China sent me those new MRIs. It's completely gone. Patient is free of any symptoms. No operation. Here we have the cartilage of the bone in your knee. You see on the left top, you see a field where you have some reddish appearance, and the white one is a cartilage. And where it's red, the cartilage is missing. And the picture on the right top shows you a white insert, which is a little bit more white than the old cartilage. It's all new cartilage that has formed. And below, you see the same from another patient. We did histologies here also from a patient. Let me show you that. In sake of time, jump a little bit. So histologies, we had 15 patients which agreed to come back after 1 year. So we could take out the cartilage, the little probe. And in fact, true cartilage forms here, which expresses all the extracellular matrix factors. And the principle is you have a better layer in the bottom attached to the bone. Polarization shows that the fibers erect. And now let me come to another major point of healthcare, which is back pain. And that also brings us to Jack, because he came with chronic back pain, and the origin is not the acute prolapse. What you see in that picture is also the spine of 3 skiing athletes. So they all been in the national German team and winning medals, but that takes their tribute, as you all know. And what you see on the yellow arrows is a normal disc between the 2 vertebrae. And where the blue arrows are, the disc is diminished the height, which in principle can make an acute prolapse. The nucleus pulposus creates some pressure on your nerve. You need to operate or wait. Nature absorbs that. But the long-term consequences is that the weight of the body is no longer distributed on the main spine area, but what you see here is a purple in the left picture. These are the facet joints, which are in the back. And these little joints are helping to maintain the position of your vertebrae. So when you bend, they make you elastic in your back. But when the blue in front is diminished in height, more of the body weight is positioned on those little facet joints, and they become inflamed over time. So 70% of chronic back pain is due to this arthritis of the facet joints. And there's a simple test, which you see here. There's a syringe and a needle. We just inject a little lidocaine to numb that. And if the patient tells, oh, the pain is gone, and after a couple of hours comes back, we know it's the facet joint, it's not a foramen or anything else which causes the pain. And these are the results from 39 patients, which we followed up for a year. So each patient on the bottom, 1 to 39, has a data point, which is the blue line before a time when before he was treated, and on the brown line after 1 year. And you see there's no overlap. All patients greatly improved. I have some slides because I talked to some from dental medicine. Bone regeneration also happens very nicely, but I just show you a simple example, as I cannot go into detail here. That's a friend of mine. He called me up and said, I just broke my ankle. I said, you should, well, what did you do? He said, I was playing football. I said, you shouldn't do it that wild. He said, it's too late. So, and then he got a cast where both ends of this broken fibula were not very much attached. I said, I don't think that's going to heal. So why don't you come to Munich? So he came, got some metal here, and we injected also some stem cells into the space between the 2 fragments. And what you see on the right picture is like 10 weeks later, we could remove the metal because it already was healed, the bone. So there is a strong healing capacity. That's a patient with hip replacement. So in summary, I would say, autologous uncultured cells, and as I said in my introduction, these are all cells from your own body. So there is no ethical concern. You take them out, you process them, you release the cells with a special enzyme mixture, and within an hour, you re-inject them. The patient even stays in the recovery room, so neither the patient nor the cells leave the place where you do the initial treatment. And it has great effects in treatment of joints, tendon, cartilage, bone, chronic back pain, with a very favorable risk-to-benefit ratio because you don't culture the cells. The risk of contamination is very low. So this is something which is very natural to my feeling, but we need further multi-center studies to confirm these initial findings, which are currently ongoing at Sanford. We do a study on back pain, one on wounds, one on non-healing, on tendon tears, and on risk arthritis. As this conference is not only cure, but also have a snap into the future, let me show you where I believe the future is going to go. And this is the induction of a differentiation of stem cells. So these are regular stem cells taken from a patient, no iPS, no embryonic cells, and we run those cells through an epigenetic reprogramming educational program, which tells the cell where the split is. The initial split, in this case, is SHOX2, then we get TBX5, and at the very end, after 3 weeks, we find non-contractile cardiomyocytes. You see there are two kinds of cells, one big, large, 50 micron large, with a red arrows pointing to, these are the pacemaker cells. When you do a single cell voltage clamp experiment, they express all the ion channels, and the rest are Purkinje cells. So at the moment we are testing these in rats, and I hope in 2 years that we can report the first patient that did not receive an artificial pacemaker, a spare part, but got a repair of his own sinus node, which was just too weak to fire correctly, and that I think will start the next generation of medicine. Thank you.
Thank you, Dr. Alt. Thank you. We only have a few minutes left, as it turns out, so let me just jump to the next presentation.
Thank you, Sanjay.
Thank you.
It's truly an honor to be here with you today. Yesterday, listening to the patient stories and the speakers, it was really inspirational to me. You know, it reminds us why we went into medicine in the first place, really, for our patients. As a shoulder surgeon, patients with shoulder and rotator cuff pathology make up the largest group of people that I see. It's a very common problem, and it affects a large proportion of the population. Just within our Sanford health system, we see about 35,000 patients every year for problems with their rotator cuff. And about 1,200 of those patients end up undergoing rotator cuff repair. This is a tremendous burden on patients, both from a monetary standpoint, as well as from the perspective of time lost from work and the time that it takes to recover from a rotator cuff repair. In general, it takes 5 to 6 months to recover from a rotator cuff repair. The rehab can be quite painful. The culprit is the rotator cuff, which consists of 4 tendons which surround the shoulder joint. They attach onto the humerus. The function of the rotator cuff is to hold the ball centered on the socket and create a fulcrum point, so the larger muscles can then raise your arm. When tears occur, they most commonly occur in the supraspinatus, which is the tendon on the top. There are 2 very important points which I need to make clear on the rotator cuff. The first is that once the rotator cuff tears, it never heals spontaneously on its own. There have been multiple natural history studies looking at this, and they all show the same thing, that a torn rotator cuff will never heal spontaneously without some type of treatment. The second point is that even after we repair the rotator cuff, re-tear rates are unacceptably high. Despite all the progress we've made in the last 2 or 3 decades to improve the biomechanical characteristics of rotator cuff repairs, re-tear rates still approach 40% in some cases. And we think the reason for this is due to the biology. We haven't figured out a way to reliably get the rotator cuff to heal back to the bone once it's reattached. And so this has been the focus of a lot of research over the last decade. And there have been multiple animal studies specifically looking at the use of mesenchymal stem cells in rotator cuff tear models. The problem is that these have all been done in the laboratory on animals. And but there have been very few clinical studies on human beings. And as one of the speakers said yesterday, we want to bring this from the bench to the bedside, and that's our goal. And so we proposed a study to the FDA to look at the use of adipose-derived mesenchymal stem cells for patients with partial thickness rotator cuff tears. A partial thickness tear means that there are still some fibers attached onto the bone, but some have torn off. So there is still some mechanical stability there. The FDA came back and approved us for an initial safety trial to first demonstrate that this is a safe treatment. It was still our hope that this would give us some indication of whether this treatment could lead to rotator cuff healing and improve patient outcomes. And it's also our hope that it will form the basis of a future pivotal study to really focus on the efficacy of treatment. So our study consisted of 18 patients who were randomized into either a control group or a treatment group. The control group consisted of 6 patients who underwent ultrasound-guided corticosteroid injections and 12 patients who underwent ultrasound-guided injection of adipose-derived mesenchymal stem cells. The patients in the treatment group underwent a liposuction procedure to remove about 50 cc's of lipoaspirate. We had lots of volunteers for this part. The lipoaspirate was then processed to separate the cells, and the cells were re-injected into the shoulder. The process of separation takes about an hour and involves both an enzymatic process and a mechanical process to separate the cells. In the end, we end up with 6 cc's of product. 1 cc is kept for laboratory analysis, and the remaining 5 cc's are injected at the site of the defect under ultrasound guidance. We then saw the patients periodically over the course of a year and collected all adverse events, outcome scores, and we did MRIs pre-injection as well as at 6 months and 1 year post-injection. It's our hope that this is not the end, but only the beginning, and will start us on the way to unlocking the body's innate, God-given potential to heal injured tissues.
Thank you. Just real quick, let me ask before we move on. The perception oftentimes is that we're still dealing very early stages here, and the sort of balance with anecdotal reports of people doing well versus, you know, the sort of veracity of the scientific method. How do you balance those two things?
You know, yesterday I think we heard a lot about the urgency to find treatments, but also we have to make sure that these are safe. And there is a lot of variety in the literature about what is a stem cell. You know, the problem is that we don't have a lot of clinical research bringing the laboratory side into patient care. And so really, we need to see a lot more clinical studies. There are places in the US where you can go to get stem cell injections. We don't always know what these are. A lot of time, they're actually bone marrow aspirates, which, you know, may or may not have stem cells within them, but we don't have the clinical data to really back up that use. And so there have been stem cell committees that have been set up, and one of the recommendations is that if you're having to pay exorbitant amounts of money to do the treatment, it's probably not a scientific process. So.
Okay, Dr. Lundeen.
Thank you. Our rotator cuff study, just to show the impact of this particular condition, when we announced it, we had within the first 3 days over 400 people calling to be part of the study. And so, as Jason was saying, the impact of this problem in the community is significant. Our results are not quite complete yet, and so the FDA rules limit some of the reporting that we're able to do. But Dr. Gupta, you just, for the skeptics, which by definition scientists are skeptics, for the skeptics in the room, the criticism of almost all of these studies is that that visual analog scales are very subjective. But our patients were evaluated, and so we definitely showed a marked improvement in the range of motion. The single biggest factor in these patients for coming into the study was for pain relief. They reported an improvement in their pain and their range of motion. But what we need to underscore is that since the patients knew that they were getting stem cell injection, by definition, there's a placebo effect. Literally what Jason was talking about is that if a patient knows they're getting an injection of stem cells and you ask them later, does your arm feel better? The natural tendency in medicine is for them to say, for sure, I feel way better. And so we were empowered by a book that you'll recognize the lead authors, because the question is a stem cell truly a healing cell? And so the endpoint that we emphasize to the FDA is that we can prove, based on MRI evidence, that there is indeed healing of the tissue. Now, I've put together some examples of what we think is a healing response, and if you go from left to right, the white defect in the rotator cuff is similar to what Dr. Alt showed in his own shoulder. But in the middle slide, I want to speak about the white space around the cuff. Now, we would interpret that on an MRI as an inflammatory effect, and one of the more dominant findings in our review of the MRI is even when we couldn't necessarily agree that there was indeed healing of the tissue, what we definitely showed, if you look at slide 2 and 3, that white inflammatory reaction around the joint is definitely improved. And this is another example. If you look at the slide on the left, we can certainly still see torn tissue. Now, when we look at it, we feel that there's a filling in of the white space with healthy tissue, but the diminished inflammatory reaction is beyond reproach. We obviously still hope that we're going to be able to prove that there is healing, but we definitely know that the pain relief, the better range of motion, is a function of diminished inflammation. Now again, for the skeptics in the room, MRI is also subject to subjective interpretation by the examiner. And we argue about, well, is the cut in the same plane? Are you looking at it the same way? And so a novel technique that we've been utilizing to try to help us differentiate what's real and what's not real is using color imaging, and it's a software program. But for example, the slide on the left shows the color image of a normal rotator cuff. Red is good, green is bad. We like to keep it simple in orthopedics. And so then the image on the right shows what we feel is a partial thickness tear of the rotator cuff tissue. And this is another example of what a standard MRI looks like on the left, same image, same patient with the color image, and you can see that the green interspersed within the red we would interpret as partial thickness tearing. And then lastly, this is the ultimate. The film on the left side shows the black portion within the green. That is a complete tear. This is a patient that's been treated, and then the color map shows that at least the black is turning to green. We don't know timeline. When I give these talks, I always start out by saying that when it comes to stem cell technology, it seems like the more we think we know, the less we find out we really know. And so we're on the cutting edge. We're doing the scientific work that it takes to really prove what role stem cells play in the treatment of disease. And I appreciate the opportunity to present this information to you today. Thank you.
Great. Dr. Lundeen, thank you. All right. So again, an honor to be with you, Jack. And we've now heard a fair amount about what this is all about, but you actually experienced it. Let me ask you, when did you first start having problems with your back?
Well, I first started having problems when I was a kid. And back then, all they did was inject with cortisone. And I had my back injected in 9 different places by the time I was 19 years old. And I think that may have caused a lot of my shortness today. But I sort of...
We're about the same height now. Just
I was 6 foot, now I'm less than 5'8".
Oh.
And, but I had a pretty decent career from a longevity standpoint. I played in 154 straight majors, which is still a record. And, you know, I probably played in about 1,000 straight golf tournaments. So my longevity was pretty good. But my back obviously got sore, hurt me. I ended up having a hip problem. I had 23. I had my hip got injured, and I had 25 injections over a 10-week period of cortisone in my hip. I think that probably destroyed my hip. At least that's sort of the assumption. I wish I'd have met Eckhard about 20 years earlier, because I had a hip replacement, I probably wouldn't have done that. But I had a bunch of minor things through the years. But a couple of years ago, a little over 2 years ago, I met Eckhard at Denny Sanford's birthday party, and we started talking about stem cells and things. And my back was hurting me, and I had a couple of my boys were hurting too. And so we decided to go to Munich and give stem cell a try. Well, I did that March of 16. I could not hit a golf ball without hurting. I couldn't hit a tennis ball without hurting. And I couldn't stand up for any more than about 10 minutes. I can now stand for as long as I want. I don't hurt when I hit a golf ball, and I don't hurt when I hit a tennis ball. That's a pretty good result to me. I'm going back and get a little bit more, because I'm actually went in. I've got a rotator cuff that is not performing too well. I've got 2 tears, arthritis, bursitis, tendonitis, and a large cyst in the head of the humerus. Outside of that, the doctor said it was perfect. So that's what I'm going to do, and my hope is that you know, without going to surgery, which I don't want to do, I would go back and do this. I mean, when I had it before, it was a matter of going in. It was seamless to me. I went in and had the adipose fat taken. An hour later, it was put back in. We went to Eckhard's for dinner that night, and next morning they took the bandages off and sent me home. And I never did anything, didn't keep me from doing anything. I played golf the next week. I thought that was pretty good. Whereas my other doctors that I talked to, it was like, well, it'd be 6 months of this, 4 months of that, you know, so forth and so on. Anyway, I had 2 of my sons, Gary and my son Michael. Both had it done, and 2 other friends. Gary had not played golf for 2 years, and now Gary's back, getting ready. He's just turned 49. He's feeling good, and he's getting ready to go play the senior tour. But he couldn't even play without that. And my son Michael had some very good relief for about 1.5 years. I think he needs a little help again now, but that's all right. Gary had one other thing which I thought was kind of interesting. Eckhard and I were just talking about it. When Gary was going through his, when he did his MRIs, he showed necrosis in his left hip. And Gary went back and did an MRI last week. He had no necrosis. And Eckhard said, well, you know, the cells will migrate to where they need to go. So I don't know whether that's the case or not, but he doesn't have any necrosis in his left hip anymore. And that to me was fantastic news. Anyway, I've become a believer. I'm just obviously not a doctor, I'm just a layman as it relates to this. And I've had nice results. And people ask me about it, and I said, you better find an airplane to Munich, or wait until we get the FDA to prove it in the United States. And I think Munich is going to be a lot sooner. Thank you very much.
Yeah. We got a couple minutes. Let me just ask a couple of questions. I should point out, this is the first time that you've really talked about this. You know, you said people hadn't asked you about it before, but people are hearing about your treatments with stem cells for the first time right now. At that moment when you decided to do this, because you had the cortisone shots in your back as well, you'd had spine surgery some 14 years ago now, and now you make the decision to have stem cells. Well, how did you approach that decision? What did you worry about? What was your confidence going in?
Well, my first run, back in 2003, the doctor wanted to clean me out from the middle of T5, the middle of the T's all the way down, and fuse 4 or 5 vertebrae. And I said, what's my prognosis there? He said, well, 6 to 9 months of a course and another 6 or 9 months of rehabilitation. I said, well, I'm not going to do that. I'm 63 years old. So at 64, I had minor surgery. we cleaned out 1, 2, and half of 4 or 5. And he said that'll take care of 90% of it. And it did take care of about 90% of it, but I still hurt. And when Eckhard talked about the stem cell, I said, you know, hey, I've been a guinea pig all my life for all kinds of things. I'm happy to do that. I'd like to get a result where I'd be able to stand up, hit something without hurting. And I did that, and I can do that.
You were one of the first 10 patients to have this done.
We were, yeah, we were.
Did that make you nervous?
No, not really. I don't worry about that kind of stuff. I was the same thing when I had my hip done. I did ceramic on ceramic with my hip when I had it done, and I was one of the first, 30 or 40 of that too in that, but I haven't had any problem with that either.
I do find it very interesting that it sounds like you've had back pain pretty much your whole life.
I have had back pain. I think that's pretty much what golfers have, but
this degree, I mean, you're one of the greats. I mean, how much did this affect you, do you think?
Well, today it affects me a lot because I can't play anymore, but and I mean, what I play is every couple of weeks, but it probably affected me a little bit while I played. I just made sure that the exercises that I did, and I kept myself in shape, and I was able to play. As I said, my longevity is about 1,000 tournaments.
Incredible.
And I had 2 tournaments in there that I withdrew from after the tournament started, but they were both with back pain. But it was only 2 of them, one in 1981 and one in 1983, so that's not much.
And I think you said you took probably 10 million swings over your career.
I took a lot of swings.
You took a lot of swings. Let me, Dr. Alt, let me just finish with you quickly because we're out of time. But how did you present this to Mr. Nicklaus? What was your discussion with him?
Actually, I don't recall the details, but his friend Danny always says, trust and respect is the most important thing. And I think it was on that level. He just trusted that we do it. He was not the first patient. I mean, I saw yesterday one here that we did about 4 years ago. So it was not the first patient which we treated. And I agree with everything Jack said, except that we sent him home. He sent himself home. We recommended to stay another day. So, but he was interested to see how his swing would be improved. The next day he went on a golf course back in Florida. But everything else is really true.
All right. Well, thank you. Yes, a warm round of applause for the panel here. Thank you very much. And yep. And let me just say good luck to you because you're about to get on a flight to go back to Munich and now have your shoulder done.
I'm going to have my shoulder done, and we're going to supplement my back.
All right. Well, we wish you luck, sir.
Thank you.
Thank you. Thank you. Thank you again. Appreciate it.
Thank you.